Now remember that central tenet of economics, that you get what you pay for. We pay doctors and hospitals to do more. We don't pay them to do better. We pay them to do more. We don't pay them for how well they take care of us. We pay them for how much they do. It's called fee-for-service, and this is how the vast majority of doctors and hospitals get paid. They get paid for every visit to a patient, every procedure performed, every stent the cardiologist puts in your chest. Hospitals get paid for every day you spend in the hospital, every day in the ICU. And doctors and hospitals are especially likely to deliver care, or unnecessary care, when there isn't a lot of evidence to guide them about when it's appropriate to give that care. They tend to deliver unnecessary care in the gray areas of medicine. And this is a little secret about medicine. Only about half of what doctors do is backed up by valid evidence. The other half is based on assumptions and tradition and new ideas. It's not based on really good evidence. So we like to say that medicine is both an art and a science. And when medical school students graduate, their deans will often say, only half of what you've learned is right. Unfortunately, we don't know which half. So our payment system pays the doctor and the hospital whether or not the treatment was based on the right half. And that's kind of like paying for cars, paying more for a car based on how many parts are in it, rather than which cars have better repair records or which cars go faster. I mean, just imagine how many new little special parts car makers would start adding on if that's how we priced cars. And just imagine how poorly they would run. And that's why healthcare runs so poorly. Hospitals aren't paid to give us the care that would keep us out of the hospital in the first place, because they only make money when you are admitted into the hospital. It would be financial suicide to keep you out. Our doctors are not paid or compensated adequately for the time that it would take to prevent disease and keep us healthy. They do get paid to treat you once you get good and sick. So I'm going to give you a specific example of how this works. They're really perverse economic incentives, and they're really bad for patients. If you have diabetes, one of the things that may happen to you if you don't control your blood sugar is you'll get an infection in your foot that won't heal, and that may lead to the need to amputate your foot. Insurance companies will often cover the amputation of the foot, but they generally won't cover the time it would take for your doctor to teach you to inspect your feet every day and care for any little cuts. In other words, the things that would keep you from needing to get your foot amputated in the first place is not paid for. So why aren't our doctors and hospitals doing what they need to do to prevent tragedies like this? Because they lose money when they provide the coordinated preventive care that diabetics need. Because preventing a diabetic from being hospitalized means lost revenue for the hospital. And because making sure a diabetic understands what she needs to do to control her disease takes time, and doctors are not paid for the time that it would take. Because all too often in our healthcare system, doing the right thing for patients is bad for business. So what does all this mean for the rest of us? It means geography is destiny. It means what happens to you when you're sick has less to do with what you need and more to do with where you live and how the hospital you're admitted to treats you. It means we're paying an awful lot for care we don't need, even as many of us don't get care that we do need. It also means that we are quietly bankrupting our economy. Peter Orszag is the head of the Congressional Budget Office, and he recently testified before Congress that the United States is on an unsustainable fiscal path. The primary determinant of the nation's health is healthcare costs. So if costs continue rising at the same rate, Medicare and Medicaid will consume the entire federal budget by 2050. By 2082, healthcare will consume half of the entire GDP. Now, I find that a very disturbing thought. Howard Schultz is the CEO of Starbucks, and he recently announced that he's now spending more on health insurance than he spends on coffee. And that means that Starbucks is basically a health insurance company with a sideline in Frappuccinos. And by 2082, the entire U.S. economy will effectively be a healthcare industry with a sideline in weapons, tourism, and financial services. That's not a sustainable economy. So what can we do? The first thing we can do is ask our presidential candidates to start talking openly about cost and what they can really do about it. Now, it shouldn't be that hard to really sort of think conceptually, theoretically, about how to control costs. I mean, there's this piggy bank out there full of $700 billion. And it's care that you probably wouldn't want if you understood that it increases the risk to you every time you go into the hospital. That $700 billion is more than enough to cover every American who's uninsured with plenty left over. And we're a long, long ways from having to talk about rationing. Number two, we have to cover everybody. I don't care how we get there. Mandates, no mandates, Medicare for all. It just has to be done. And not just because it's the moral thing to do. It's the right thing to do from an economic standpoint. Number three, we need a Manhattan Project for medical evidence. Half the time your doctor is flying blind, and we need to publicly fund a crash program to find out what works and what doesn't in medicine. And then we need to stop paying for the stuff that doesn't work. And finally, we need to pay for healthcare in a completely different way. We need to pay for value, not volume.